How is he?
He's a bit better, I suppose. He wants to see you.
I'll go up now.
It's been 4 nights now.
Don't I know it? You're not the only one doing the early shift.
No, I was just thinking maybe I should take him to see someone.
He's been bad before.
No, he hasn't, not for this long.
Well, who were you planning to take him to see?
We're still registered at Riverside. I could get an appointment.
You know how I feel about that. Look, I've got to go to work. We'll talk about it later.
Oi, oi, heavy night.
Oh, good say.
Well, I'm offended. A night on the tiles and I'm not invited. You know I don't get out much.
All right, Mac. So, are you drinking that?
So, what'd you get up to? Is there someone else?
Does the name Stella ring any bells?
Should it?
I think you've been out with her before.
I can't think. What's her last name?
Artois. She's a French girl.
Oh, stop, you're killing me. By the way, she's Belgian.
Well, I bow to your greater knowledge, but you're still 0 for 2.
Classic evasion tactics. I can only imagine you were doing something really sad.
Oh, well, imagine away.
Well, it's okay. You just stick with me. I'll show you a world of pretty cars, fast women.
Okay, enough. Chris came round, we had a few beers, and now I've got a headache. Is that sad enough for you?
Well, I was hoping for something a little bit
What
more
hope
juicy.
away in silence, will you? I'm going to sit here and just wait for my brain to shrink back to its normal size.
What the?
Yeah.
Hiya. Here you are. Be careful, I've warmed it. All right now, eh?
Whoa, nice bike.
Yeah, mate.
Please take a seat, Mr. McIntyre. Hey, this must be Jamie. Some nasty cough you got there? Well, we haven't seen you in a while.
That's right. You know he's got asthma.
Oh, I do now.
It's probably in there somewhere. He's had it for years. Not that it's been a problem or anything. It's just the last few days he's been getting worse and worse. He hasn't been to school for a week.
Well, I bet that makes somebody very happy.
Well, he's not complaining. But Leonie and I have been up with him every morning. You can hear him from the other room.
Right. Mind if I have a listen? Okay, deep breath. And one more. So what have you been waking up? Is it the cough?
Yeah.
And the wheezing. I know he looks okay now,
But you're worried. Okay. Getch. Do you want to show me how you use one of those?
he's not on inhalers. Yeah, actually, we've been using these. They're essential oils. Aromatherapy. You put a few drops on the bedclothes last thing. A lavender and evening primrose to open out the airways.
And he's not taking anything else?
I'm afraid Leonie and I aren't really happy to let him have medication.
Leonie,
My wife. Yeah. She's at work.
has he ever been hospitalised with the asthma, Alan?
Oh, never. As I said, it's not been a problem before. It's just the last few days.
But you were concerned enough to bring him here?
Well, I was hoping you would recommend an alternative treatment, something new we could try, something herbal.
Well, I'm afraid I only usually deal in these. But perhaps we could have a word, you and me. I'll get Joe to look after him. Jamie, do you want to step outside? I think we've got a remote control car out there if you're interested. Now, I don't suppose you speak any Spanish. Joe, can you look after Jamie for me, por favor?
No problem. Hello, Jamie.
I have to be honest with you. I'm worried about Jamie.
That's why I'm here.
Sure, I know. It's just that this stuff, it's not what he needs. His asthma is getting worse, and I think he should have some proper treatment.
Which means?
Don't get me wrong. I'm not completely anti. Alternative therapy has its place, and there's a lot to be said for it, but in this instance, I don't think it's right to experiment on an 8-year-old asthmatic.
You think I'm experimenting on my son?
No, look. Let me put it another way. You said yourself he's been getting worse. Now, I don't know what's triggered that off, but what I do know is that it can go downhill from here.
That's why I brought him to see you.
You said he's been bad every morning this week. That's called a morning dip. It's not a good sign. If he deteriorates further, then... Well, then...
Well, what?
Then things can get serious. Really serious. Asthma's common, but people still die from it. They die every week. And it's medication like this that keeps them alive.
Look, I appreciate your concern, but I'm just not happy to fill him full of drugs. It's not as if we haven't discussed it. Leonie and I have talked about it and we've come to a decision.
Well, I'm afraid you're making the wrong one. He needs treatment. The right treatment.
Okay, fine. You've said your piece, and I've sat here and listened. It's obvious to me you've no respect for any views other than your own. No, I made a mistake coming here. Now, where's my son?
Can I run something by you?
Is it shop or personal intrigue?
Shop, I'm afraid.
I don't know. No one ever asked my advice on anything else. I like a bit of scandal as much as the next woman.
Sorry.
Okay, shoot.
I've just seen this kid, Jamie McIntyre. Never been in before. His dad's just brought him in.
Single parent?
No, his mum's at work. Anyway, he's asthmatic.
How old is he?
8. The thing is, he's been getting worse all week. Wheezy, nasty cough, dipping every morning.
So what are you treating him with?
That's just it. His parents are into alternative therapy. Been giving him aromatherapy treatment.
Well, that's okay. Just start him on inhalers. There's no need to stop anything else. That way everyone's happy.
Well, they won't let me. You know how it is. Anything produced by a drug company is the work of the devil.
I see. So what do you want to do?
Oh, I don't know. You're a good doctor, right? So you know how it is. If you're good, there are certain things that scare you. You learn. Some things you let go, and some things you don't.
Yeah.
Well, I reckon asthma's one of those things. I can't just sit back and watch this kid get worse.
But if his parents don't want him treated, what are you going to do? Kidnap him?
If only. But there's got to be something. Maybe we could call social services, get a court order.
So he has the treatment. What then? If you involve social services, you risk alienating the entire family. Do you think they're just going to change their minds and apologise? They do have a right to their opinion.
So, what do I do?
Go and see them. Try to persuade the mother. Just don't jump in feet first.
And in the meantime, what about the kid?
Well, no one ever said it was going to be easy. I'd go and see them.
Okay. I'll give it some thought.
So, no gossip then?
Afraid not. Been a quiet week. You'll have to provide some of your own.
I'll do my best.
Working lunch.
Well, this is work, and this is hardly what I call lunch.
Join the club. Mind if I pick your brains?
Pick away.
Let's say you've got a kid who's being refused treatment by his parents. What do you do?
Well, it depends.
On?
Well, what kind of treatment if the kid's in danger?
Well, let's say he is. Let's say you think he's at risk.
Well, you could try and get a court order, talk to a social worker, but you've got to be sure. I mean, you've got to be really sure. Getting involved with social services is like sticking your hand in a nest of wasps.
Meaning?
Meaning you don't do it.
But that's the procedure.
Yeah, basically. Why? You got a problem?
Nah, not really. Just asking. Thanks.
You're welcome.
So, how are you?
Well, you know, life goes on. Got a few more lines on my face since I bought the restaurant.
But it's going okay.
Yeah, not too bad. Considering I've had builders in there now for 6 weeks come tomorrow.
Ouch. You know what they say, once you've got them, you can't get rid of them.
Yeah, so it seems. So, could you give me an estimate on this?
Has the swelling gone down? One knee in perfect working order.
So, why does it feel like I've gone 10 rounds with Mike Tyson?
I'm sure it was just a strain, nothing to worry about.
So you're saying I'm okay?
Well, you should take it easy.
Do you think I'll ever dance again?
You don't dance.
You don't look so surprised. You are, in fact, sharing your consulting room with the undisputed Licky Hills disco dancing champion of the world.
You? You're a disco dancing champion. Since when?
Since 1983, to be exact. And they say you never lose it.
I don't believe you.
Well, I have a certificate here somewhere. Oh, I've left it at home. I'll tell you what, I'll prove it to you.
What are you doing?
I just thought you'd,
Chris was just showing me his, dance routines.
That's all he was showing you. You seem to have made a full recovery. I thought you might need those.
Well, now that that's all cleared up,
I never should have doubted you.
So, do I need to come back for a checkup or anything?
Not unless you have any other problems.
Problems?
Well, apart from the obvious.
Well, I might well come back. Take you out dancing.
Oh, no. You're far too good for me.
Yes, I suppose I am.
Hello, Mr. McIntyre? Look, sorry to bother you. It's Dr. Mystery from Riverside. It's about Jamie. I've been talking to a couple of the other doctors and... No, I understand. Look, it's just that I think we ought to... No, that's fine, but... Hello, yes, can I speak to the duty social worker, please? It's Dr. Mystery from Riverside. Yes, it is important.
Hello. Speaking. I don't understand. Why do you want to interview us? I suppose so. Okay. Goodbye.
I enjoyed your audition to become the youngest member of the Brat Pack.
Really?
With Wayne's sleep impression in the surgery. I mean, is that a registered seduction technique, or did it just come to you in a flash of inspiration, huh?
Yeah, right, you're talking about Helen.
Nothing changes, does it? I'm just glad it's not genetic.
You think I was coming on to her?
Well, at least I can think. I mean, it's just a reflex with you, isn't it? Straight round the spinal cord. The cerebral cortex doesn't stand a chance.
Oh, sorry, now you're blinding with science, mate.
Don't try and wriggle out of it. I know what you're like.
Oh, really?
Especially where blondes are concerned.
Well, now you know I don't discriminate. Anyway, what's it to you? Unless... Well, look, bro, if I'm stepping on your toes, then just say the word. I'll back off, no problem. I watch EastEnders. Never let a woman get between family, only causes trouble.
I'm not even going to dignify that with a response, you know.
OK. What's eating you, then? Jealousy aside.
It's just, she's a colleague. Things that get complicated. Believe me, Chris, I've been there.
I see. You forgot to mention the fact she's married.
Yeah, well, that as well.
Look, whether or not you think I'm the reincarnation of Peter Stringfellow, I'm telling you there is nothing going on. It's strictly doctor-patient, pure as the driven snow, OK?
And the dancing?
Just showing off. Simple as that, just having a laugh.
Yeah, we'll keep it that way, all right?
Ja, mein Führer. I hear und obey.
Anyway, you're around.
How's your head?
Getting worse.
Who's in charge here?
I'm sorry.
I want to see the person in charge, and I want to see them now.
Well, do you have an appointment?
No, I don't have an appointment. My son saw Dr. Mystery this morning, and now I want to see him or whoever runs this place.
Can I help?
And you are?
Brendan Maguire, I'm the senior...
Which means you're in charge.
On a good day.
And maybe you can tell me why my husband has just received a call from a social worker accusing us of putting our son in danger.
Look, why don't we talk about this in my room? It's just through there. I'll show you.
Do you fancy a sandwich? I'm just making one.
No cheese.
No cheese.
Right, Mrs. McIntyre, why don't you tell me what's going on?
Nick brought my son in today to see Dr. Mystery. Against my wishes, I might add.
And what's the matter with your son?
Well, Jamie's got asthma. He's had it for years.
And your husband was worried?
It's been a bad week. He's not been sleeping. Jamie, I mean.
Mm-hmm. So what did Dr. Mystery have to say?
What didn't he say? He basically accused Nick of neglecting our son. Insisted on filling him full of drugs. Of course, Nick refused and took him home. Then a couple of hours later, we get a call from a social worker saying we've been reported. Apparently, Dr. Mystery thinks we're child abusers.
I take it you weren't happy with his advice.
You could say that. I can't see why anyone in their right mind would want a child taking that stuff. Some cocktail of chemicals cooked up in a laboratory. I know what happens when you doctors get your hands on people, and I don't want it happening to my son.
Well, wasn't Jamie on any sort of medication?
He was being treated with a combination my homeopath recommended. I wouldn't expect you to understand. That's why I didn't want him coming here. Well, it's all a little late now, isn't it?
Well, there's absolutely no reason why you shouldn't keep on taking it. But if Dr. Mystery thinks he ought to be on something else...
I don't want him on anything else.
I really can't see that he could do any harm.
No, of course you can't, but then it's the same old story, isn't it?
Which is?
Oh, you know the one. Doctor knows best. Keep right on taking the tablets.
Look, I'm sure Dr. Mystery was just trying to help. Maybe he and your husband got off on the wrong foot. Perhaps if you brought Jamie to see me...
You just don't get it, do you? I don't want my son coming to this place. I don't want him seeing you, Dr. Mystery, or anyone else. But it seems that's not a choice I'm allowed to make.
I'm sure Dr. Mystery did what he thought was best. And you have to see his point of view, but... The thing is, Mrs. McIntyre, when people come here, they, well, they really do seem to want to hear what we have to say.
More fool them. My father had cancer. Lung cancer. Of course, he smoked all his life. The GP sent him to the hospital. The consultant was very nice. Charming, even. Told us what needed to be done. Course of chemotherapy, radiation treatment. All essential. Or so it seemed. So we signed on the dotted line. And then I watched my dad wasting away in a dirty hospital bed. One tube up his nose, one in his arm, and a catheter. And every day the nurse came and pumped him full of drugs twice on Mondays and Fridays. And do you know what they were? Poisons. They were supposed to poison the tumour, destroy the cancer. Instead, they killed him.
Mrs. McIntyre, the cancer...
Oh, I know. The cancer would have killed him anyway. That's what they said at the hospital. But he had no dignity. Not all hooked up like that. And if that's what the 21st century has to offer, I don't want it, and I don't want it for Jamie.
But don't you think they did everything they could? That they wanted to help him?
They took away his dignity. I can never accept that.
No, well, I appreciate your concern, I really do. I'll have a word with Dr. Mystery, get his side of... I'm sure we can sort this out.
I hope you can. I won't be bullied. Not by you or your practice.
So, will you leave with me for the time being?
Oh, sorry.
Can you excuse me, please? I'll be in touch, I promise. Come in. Sit down. So, do you recognise her?
Should I?
Mrs. McIntyre, the lady you've just reported to social services. Do you mind telling me what you were thinking? Or whether you were thinking at all?
Look, you don't know the full story.
No, absolutely. So why don't you tell me? And it better be good.
Quick, it's Jamie.
That's what it was all about, was it? When you came to speak to me this morning?
I thought I should discuss it with you.
Discuss it with me? You asked me a question, a hypothetical question, then you just waded in.
I was doing what I thought was right.
You tricked me, Rana. You knew I wouldn't agree with you, so you just gave me half the story. Did you talk to anyone else before you started shooting your mouth off?
Helen.
And what did Helen have to say?
She told me not to do it.
Ah, she told you not to do it. An experienced doctor advises you not to do something and you go and do it anyway.
In my professional opinion, the child was in danger. That's what I told social services.
Do you think you behaved in a professional way?
I see a kid who's being denied treatment because of his parents' views. They're mistaken views, and I'm supposed to sit on my hands? He needs proper treatment, Mac. A bottle of herbs isn't proper treatment. We both went to medical school. I suppose I must have missed the lecture on the homeopathic treatment of acute asthma. Perhaps you can enlighten me.
And you know all about it.
Maybe I know more than you think. I watched a friend die of asthma. And he took his medication. He got up on Monday morning and went to work. At 3 o'clock I got a phone call. By Monday evening I was sat with his mum and dad watching a ventilator in ITU. So don't tell me to sit on my hands when I see a kid in my room fighting for his breath.
Good. You're concerned. Well, so you should be. But you deliberately misled me. And that is totally unacceptable.
I've got work to do.
Look, I'm going to phone the surgery. We can't wait any longer.
I don't want them here, not after today.
Look at him. I'm calling them.
Okay. Rana, it's Mr. McIntyre on the phone. His son's not well. He needs someone to go and see him.
Tell him to call 999. Tell him I'm on my way. The ambulance on its way. Jamie, just sit up for me. Well done. Okay, breathe slowly. All right, it's going to be okay. Just going to put a little mask on you and it's going to make things a bit easier, okay? Just give me a moment.
What are you doing?
I'm trying to save his life.
What is that thing?
It's a salbutamol nebulizer. Once the vapour gets through to his lungs, the salbutamol can help dilate the airways.
No, I want you to wait. I said I want you to wait.
The mask stays on. Your son could die. I've just started the treatment that could stop that from happening.
Stop bullying me. I don't want this.
Look, I know what you think and I know what you believe to be right, but you've got to trust me. I know what I'm doing. I know how to save Jamie's life. So You're asking me to stand here and do absolutely nothing. I simply can't do that.
Hello there.
Hi, I'm Dr. Mystery, the family doctor. This is Jamie, 8 years old.
Hello there, Jamie.
Known asthmatic with recent worsening. Just given him 5 mg of salbutamol. There you go, Jamie. All right. It's okay.
Is he going to be all right?
He's got a good chance.